Welcome back to Perspectives Podcast, the show where we uncover the best ways to help our furry friends live longer, healthier, and happier. My name is Yenting and I'm your host. Today we have a guest who's making waves in the world of pet wellness, Dr. Daniel Tan, a certified animal chiropractor who's been transforming the way pets move, feel, and thrive. Now, chiropractic care for pets. The question here is, does it work for pets? Is it safe for pets? How does adjustment actually looks like on pets? Now, I genuinely believe that as pet parents, we owe it to our pets to look beyond the traditional and explore different approaches or perspectives that might improve their quality of life. So we're about to separate fact from fiction today when it comes to chiropractic care for pets, and we've got a live demo coming up, so where Daniel will actually show us live adjustment on a dog. So stick around, catch us on YouTube or Spotify video to watch the demo. So to kick things off, I want to talk about the most common reactions that people have. I myself included when I first heard about chiropractic care for pets. So be honest, do you ever get clients come up to you and say, "What? My pet needs a chiropractor?"
Yeah, right. So that question is probably some of the most common questions that we get, especially in
Yeah.
Malaysia. Actually, if you talk about animal chiropractic in the Western countries like America or Australia, it's actually pretty common.
common?
Germany as well.
Yeah.
But in Malaysia, yes, this is relatively new. I would say patient that have been to chiropractic regularly, this concept is easier for them to digest because they understand and they can relate. But as for a patient that haven't even been to a chiropractic clinic before, they probably wouldn't know what is this about. And yes, they'll probably be really curious. Then you have to explain to them in a way that they can understand. So
Yeah.
the easiest way for you to understand this is, you see, the thing about spine is that it's just like every other part of the body. So if you want to take care of your teeth, you go for a dentist, right? So and you have a regular check from time to time. If you want to have like a good skin, you go to like a beautician, have your face cleanse and toner, moisturizer and all that. So
Yeah.
when it comes to the spine, it's the same, right? How to take care of your spine and your joint is to have them all in a good alignment. So kind of like a car, if you drive them for a little while, sometimes you drive them rough, you go through potholes and all that, the alignment tends to go out of position.
Yeah.
So then you want to bring the chassis back to the right position. Otherwise, over a period of time, some areas will start to have some damage. And one damage leads to another, and another.
I
So
think
that's the easiest way to understand.
that's a very good way to help people understand
Yeah.
why we need chiropractic care
Correct.
for pets. So, but for many pet parents, I think it's not obvious when something's off, especially if their pets, for example, if they're not limping or showing visible pain. Right? I myself included as a pet parent who's recently lost my first dog. I often reflect and realize as I think back that the discomfort that he was actually feeling actually shows up in the tiniest and smallest ways.
Yes.
And we need to get better at paying attention to that, right? What are some subtle signs that a pet might actually need chiro care?
As a pet's parent, I think the little signs you look for is, the first one is usually behavior. Do they have any behavior change? So when a dog is having any pain or any distress, the first thing you notice is the way they sit in a static position. Probably rather than sitting in a symmetrical position, you start to see them like curling to the side, like always sitting on a painful side. They will always lie down on a painful side to guard that sort of area.
Right.
You will notice that they stretch a lot more often than before. Like they will do that kind of yowling sort of stretching. They'll do that very often. They'll become less active. Like they will not run or jump up like up and down as how they were before. You'll notice that they'll become more clumsy. When you're touching them, when you're interacting with them, you'll notice that certain areas or the joint, when you touch them, they will not like it. They'll have like a sudden, that sort of reaction. They'll look back at you.
away or like
Exactly. And they will sudden twitch. Sometimes with some really sensitive dogs, or even I wouldn't say sensitive dogs. With some dogs, when they have swelling at the back,
Right.
when you run your finger down the spine, you can see that certain areas when it's painful, irritating, you can see the skin almost like
Twitch.
there'll be like a very obvious twitch. You can actually see that.
Yes.
Those are also one of the common sign. Obviously, then when it comes to the way they walk, you can see if they're having any change in their gait pattern, like if they're having any drag foot, like the leg is dragging on one side.
Right.
Do they look like it's not fluid? Usually when dog walk, right, you can see that everything should be moving in a very fluid, symmetrical pattern.
Right.
If you start to notice any asymmetry, when they start to walk a bit differently, and then they start to curl towards one side, or the position just become really curved like that, those are all signs, yeah, that you have to look up for. Yeah, it's just that,
Very interesting.
yeah. Actually, if you train yourself to be more sensitive in that sense, you can actually pick up a lot of things.
Yeah.
Not just dogs, human alike, actually.
Nice. Very interesting. Okay, so let's break pet chiropractic down from the very beginning. For those pet parents who've never heard pet chiropractic before, how does it work?
So when it comes to chiropractic, like I mentioned earlier, what we do here is to maintain the alignment of the vertebra, correct?
Right, okay.
So I mean, obviously the spine is one thing, but basically we check all of the bones position.
Right.
Think of us like a mechanic.
Okay.
We just have to make sure all the bones in the right position, because whenever the bone is not in the right position, the joint will start to suffer from excessive pressure. That's when arthritis and all this problem will kick in, right? So the first thing that we will do with pets coming in, we'll assess again, like what I mentioned, the behavior.
Yeah.
We'll look for any swelling, any edema, any like out of position bone that we can see visually.
Right.
Then we'll start to feel and check with just feeling, sensitive touching, and
Right.
all these things are the things that we've been trained for. Then obviously we will have to assess them in a certain motion. So all of the bone, they should be able to function in a certain way. So for instance, if I were to move my elbow, they should be able to move like that. But if
Yeah.
I were to move in a certain way, it can't move anymore, it got stuck. We know that
Something
there's
is off.
something is off there.
Right, right.
Yeah. The last one, obviously, if there is any X-rays available or there's any instrument available, we'll do that as well.
Right.
All this is to put all the little things into puzzle.
Yeah, I mean, it feels like you're a little bit of a detective there, like
Exactly.
trying to find out what's happening,
Yes,
right?
yes.
So, what kind of issues do you usually see in your practice? I think just now you mentioned like hip dysplasia or
Yeah.
like patella, right? Like,
Yeah.
what are some common issues?
I'll say the most common thing that patient or the parents will bring the patient in is usually when the pet is having pain. Say they have like a bad fall, suddenly start limping. Those are the common one. They notice the dog is not as active as before. They notice that the position is really odd. Start to notice that the back is curling up. Those are the kind of, and obviously the very common one is limping lah. Just like one leg suddenly like limping the whole time. Those are the very common symptoms that we see in the clinic.
And then chiropractic care can actually help with that.
Yeah, absolutely.
Wow.
Absolutely, yeah.
Interesting. Okay, well, I will ask you about like transformational cases in a little bit, right? But I'm just
Yeah.
really curious because I think not everyone would have a full understanding of what pet chiropractic is, right? Like, what are some of the biggest misconceptions about pet chiropractic that you often have to address with your clients?
Yeah. I think with the video these days, a lot of videos that is viral are usually the one that is very sensational, like ASMR.
Yeah,
You know, like very dramatic videos, and then they just crack left and right and all
that
that.
at all?
No. Actually, from we have to go through a certain exams, very tight regulations in order for us to get the certification.
Right.
And this certification is governed by an international board,
Body.
IVCA, International Veterinary Chiropractic Association.
Right.
And I mean, you know, like how the Western countries, right? They treat pets like, I think they take pets more seriously than, I don't know, taking considered in the ranking of the society. Usually, women comes first, and then pets, and then men.
Right.
So you can imagine like how serious they are when it comes to that.
Yeah.
So all these adjustments is usually very gentle, very specific. You can't apply adjustment that is similar to human to a dog.
So
It doesn't
it
work.
should not be the same.
No, it cannot be the same. Yeah, and you can't adjust a dog left and right, up and down, and a lot of crazy adjustment that you see out there, very loud and very dramatic. They're usually not the best way to do it.
Oh, those are the ones that I see on Instagram all the time.
Even with humans, adjustment is the same. It's very sad, but these days the video can be very misleading because people like to see things that is dramatic.
True.
And then they just, and because of the view, the algorithm is pushing a video, and then more people like that kind of things, and that just sort of become like the first thing that people comes into mind. Chiropractic or pets chiropractic supposed to be like that. In fact, the adjustment where you will see later is actually very gentle, but when you get a very specific bone to the right position, you can actually transform the dog's life very quickly. You can see the symptoms start changing very quickly.
Wow,
Yeah.
that's amazing.
Yeah.
I know you're not a pet communicator, obviously, you're
Yeah.
a pet chiropractor, but what is it like from the dog's perspective? Like,
Yeah.
how do you, like, when you work on the dogs, how do they usually react before and after a session?
I'll say the most obvious one is, I wouldn't say within a day.
Right.
Usually in the first session when they come in, obviously you have to give them time because they're not like human. It takes time for them to build trust. So you can't rush in and do an adjustment unless, for example, later I'll be bringing Hudson to come over.
Yes.
And Hudson, it's my patient's pet, and I've seen Hudson first one or twice.
Yeah.
So we sort of have this a little bit of
Trust.
a bit of trust, and the bond is there. So he's gonna be okay with me.
I
But with
see.
other kind of pets that's coming into the clinic, usually even the first session we might not even perform an adjustment sometimes if they are too fearful, because we don't want to force them into things that they're not liking.
Yeah.
Otherwise, then the next time it's gonna be really difficult.
So you've had patients come, pet patients come in,
Yeah.
and then it's like a meet and greet, and then like
Sometimes,
leave,
yeah.
like you
Correct.
could not adjust them.
Correct. Especially we're talking about big dogs, right?
Yeah.
Yeah. But most of the time after the first session, when they start to improve, the second time when
They'll
they
look
come
forward
in,
to it.
yes, they'll really like it. They'll start and come here and hug you, lick you, and all that. Yeah, you can see that difference. It's very
Do you feel like if they are in a lot of pain or like, they're probably feeling a lot of discomfort, they may reject you even more because they feel like you're probably hurting them?
Yeah, I mean, I say handling of dog is very important. You can tell almost like even if you go to a vet clinic, right? Sometimes when some vets really knows how to handle them, you can tell that the dog looks forward to go over because they feel better.
Yeah.
But sometimes if you just want to get things done quickly, sometimes the dog would really not like you, and then every time you bring them there or close to a clinic, they start shaking and you don't like it and all that. So those are the things you have to be careful about.
Yeah. So you were saying just now in terms of like the after effect of the treatment, normally you say like between 1 to 3 days you would
Yeah.
see the difference.
Within 1 to 3 days. Usually for one session, we'll gap it for around a week or so. After a week, we'll get the patient to come back in again. We'll check again just to see what are the changes. But I personally love to keep in touch with my patient. I would
Yeah.
always ask the parents to send me videos and update me from time to time. How's the dog walking? What's the
Yeah.
symptoms before and after? I find that a bit more connecting between
Yeah.
me and my patient. Yeah.
Definitely. Well, now I'm very, very excited to see how it looks like in real life. So
Okay.
let's bring in May and Hudson to show us a live demo of Chiro.
Okay.
And this is Hudson. He is an 11-year-old mini schnauzer. And Hudson's actually going through a lymphoma cancer kind of period in his life now. We found out at the end of January. And since then, he's been receiving chemotherapy every week at the hospital at UPM. They're the only vets in KL that do provide chemotherapy for dogs. His journey's been pretty good so far. We've seen some improvements. And along with that, Hudson has a heart issue as well. Enlarged heart tends to be quite common for the smaller breeds, the mini schnauzers. And with all that stress he's carrying, his back is a little out. He plays pretty hard with his
Still very
Cat.
active.
brother and large sister. And he gets about 6 walks a day.
Wow.
Yep, so he's super active.
Right.
And that's why we're here to see Dr. Daniel.
Yeah. So,
Still looking really strong, huh?
yeah.
Yeah, we would check them for like when they're walking and all that to look at the gait and make sure that everything is walking smoothly. A lot of times, the first sign that you can see if a dog is having any issue with the musculoskeletal problem is from the way they walk.
The way they
could
walk,
be
right.
either limping, crabbing, meaning to say they walk sideways.
Yeah.
Sometimes they'll be trembling, or you can see some dragging with the toes. Those are some general signs.
Right.
And then we would also assess by feeling for swelling. So if you go gently like that, touching all the way down the spine, you can actually find some of the joint that is swollen at the surface area.
Okay.
I mean, I wouldn't suggest you to poke around for
Yeah.
people who's untrained, but those are
Right.
the things that you can do.
Right. So when you're running through like your fingers on it, you can feel some parts that it's a bit swollen.
Yeah, it's a bit swollen.
Right.
Yeah.
Right.
Yeah, so just now I had the chance to feel a little bit with Hudson's back, and I find that the lower back and the shoulder do have a bit of swelling. And I think May mentioned that you know, he do have a little bit of discomfort at the lower back and the
Right.
shoulder area.
So
that's
it shows in your assessment as well. That
yeah,
the
it does. It
inflammation
does.
is there.
It match up. Yeah. And for most of the dogs that haven't received any chiropractic treatment before, it's almost like a car that haven't been sent for an alignment for a long period of time.
Yeah.
Some of the bone tends to go out of position,
Right.
especially if they are very active, they play very rough. That kind of things can happen.
And this is his first ever adjustment, right? I'm guessing.
I think so.
Yeah.
Yeah, this is her
okay.
first. Yeah,
Okay.
his
His first, yeah.
That's right. Yeah.
Okay.
Okay, so then we have to check all of the bones, right? And so including pelvis all the way up. So what we do here is to apply some gentle pressure to move around and see if the bone is functioning the way that it's supposed to be.
Right.
So for instance, like right now, okay, because his leg is not in the best position just yet. So sometimes you get signs from the dog. See, for example, when I'm touching on a certain area, you can see that they don't like it. They start to twitch. Yeah, those are some of the signs, and
So
I
it
do
means
find
that
that.
he's in pain or like.
Yes, they don't like it.
That's-
Yeah.
right.
Dog reacts very differently. Sometimes they will twitch. Sometimes they'll start screaming. Yeah. Sometimes they'll just straight off move away. They will usually give you very clear signs
Right.
what they like and what they don't like.
Yeah.
Yeah. And then we'll just check all the way up. When we assess the whole musculoskeletal system, we usually start from the spine and then we'll check the limbs once the spine is clear out. Because a lot of the times when you have a spinal problem, it can affect the limb as well.
Everywhere else, right?
Correct. So that's why a lot of the dogs you have, like, especially Pomeranians,
Yeah.
like kind of small breed dogs. You heard of patella femoral syndrome?
Patella,
Yeah.
no, patella
Yeah.
luxation, yes,
But,
the same thing? Oh,
Same thing, yeah.
okay.
So meaning to say that the patella is actually
out of
correct,
position, right.
So a lot of the time that happen, I mean, partly because that kind of dog is
Prone.
genetically
Yeah.
modified, right?
Yeah.
Another reason is because the leg muscle is just not strong. So if there is any lower back issue that is affecting a nerve, it can actually cause the muscle to not contract normally. That's when the patella can shift very easily.
Right.
So that's one of the common things as well.
Interesting.
Yeah. So we always clear the spine first. Once we clear the spine, then we'll work with the rest.
Like right now, I'm guessing he's not feeling any pain or discomfort.
No,
Yeah.
he's all right. He's all right. But here, definitely some things going on there actually. So I'm actually picking up something going on there. 11. I'm just gonna assess the whole thing first, and
Yeah.
then I'll do the adjustment one shot later. Usually we'll have the dog to walk around and assess the rest as well, but because today we're doing a podcast, so
Yeah.
we probably wouldn't have him walk around. So checking the
Neck
top part of the head, yeah, that's also very important because the neck does affect a lot. Yeah, because the neck basically is the one, almost like a gateway
Right.
for the whole spinal cord to run down. So if there's any neck issue, it can affect a lot of the system.
Yeah.
So her pelvis is pretty clear. I do find that there is an L7 problem. So
So that's the part which was inflamed earlier, right? You're saying.
and then just a quick pressure there. There. Sometimes they'll start to blink and then they'll lick the mouth a little bit
He was
and
just
just feels a
"Ooh,
bit.
what's
Yeah,
that?"
what's going on? Yeah. But I feel like I can set it a little bit deeper.
Right.
Right? Let me check again. And usually after the adjustment, in the first month or so, there's going to be a lot of changes happening to their spine and the body, and the symptoms will change a lot. So we usually get the parents to take a video, record it down, just to observe and see how the dog is behaving.
Right.
Yeah. Okay, I think we might be able to give it another go. Yeah, just a wee bit more. Okay. Hey, okay.
His reaction
Yeah.
was like, "Ooh."
Yeah, you're right. I think that was okay. Okay. Let's check on this one here. Which one is the one that I find just now?
So this is the meat part, right?
That's correct, yeah. Their spine is actually very different in human. Yeah. So some of the videos out there that you see where they apply similar adjustment as a human,
Yeah.
it's actually pretty scary.
Oh.
Yeah. Like we don't really agree to that. At least from what I understand anyway.
Okay. Tell us more later.
Yeah. That's good. It's good. He's distracted now.
Yeah. It's not shaking at least.
That's okay. Here. Stand there. You okay?
The same reaction again.
He's like almost there, almost there. One last time, okay? Close. Starting from there. You okay? All right. Okay. I think that's okay.
Job, Hudson.
Last one. Just gonna check this real quick.
Okay.
Yeah, it's much easier with me here actually.
Yeah.
Lower back is really good actually for his age.
Yeah.
Not bad at all. We have to start part by part.
Right.
It's not like some of the videos where you see out there where you just adjust the whole thing.
Entire body, yeah.
Yeah, that doesn't make sense. Simply put, if you have a baby, you wouldn't crack the baby's spine from top to bottom for no reason, right? Because usually when injury happens, it happens at one segment. And that one segment is the one that you have to correct. The rest of the bone, when they're functioning okay and they're in a good position, you leave it as it is as original.
Right.
Yeah.
Right.
And you'll be surprised, like a precise adjustment like that, it can make a lot of difference.
I'm sure.
Yeah.
I'm sure it would. Well, thank you so much for the live demo. Thank you, me and Hudson, for the appearance.
Yeah. We'll check again. We'll check with Hudson's again. So when you go back, you can do the same, like just ice the back and then just, ice massage with the swollen area.
Are there any like simple stretches that can probably help Hudson?
I would say stretching can be difficult, like unless sometimes is he happy to lie down on the side? Yeah. If it's depends on the dog. Like
Right.
some of the dogs are really happy to lie down on the side.
Yeah.
If they're happy to lie down that way, I would sometimes then just extend the hand a little bit, kind of like how you're doing stretch for the legs and your
Right,
hands for yourself. But you got to be very gentle. Yeah. You can also just massage around the spinal area gently, just do circular massage like that along the spine. I think they really appreciate that.
Yeah.
But again, everything that you do, just go gently with them. You don't want to be too rough with them.
Okay, so just now you mentioned that pet chiropractic care is very different compared to human, right? Can you explain a little bit more?
Different in the sense, I mean, as a practitioner, when you treat them is very different because with human, we know how to comply, right? We understand commands and all that. Not to say pets, they don't, but sometimes they move around, sometimes they get very excited. So when it comes to treating and adjusting pets, it usually requires a lot less effort compared to human because the bone is so
Less effort.
way less.
Right.
Because in Australia, when I took the certification, we also did adjust some horses.
Yes.
A lot of when I mention to my friend, most of the time the first impression they have is, "Oh, you must be really strong to do." Actually, it's not. When it comes to adjusting, because with the horse, right, we have a what do you call it, a bill. So we actually step on a bill, like you're way higher. We just have to lean over with our body weight, and we can adjust the horse. Yeah. So when it comes to dog like this, right, because the bone is so small compared to human, unless we're talking like really big dogs, right?
Right.
So it doesn't take too much. Especially working with small breeds is very easy, but you just have to be patient.
Yeah.
You have to read your sign.
True.
And the assessment is very tricky because they're constantly moving. Yeah. So I would say when it comes to working with dogs, assessment is probably the hardest part compared to adjustment. Yes.
Okay.
Exactly. Yeah.
Okay, interesting. I want to talk about your journey in a little bit, but okay, now let's say I'm a pet parent and I'm convinced that yes, I need pet chiropractic care for my pet, right? What are some red flags we should look out for when choosing the right chiropractor?
Oh, that this is an interesting question. Okay, first of all, I think in Malaysia there is not much
Exactly. Yeah.
chiropractor. I think there is only, if I'm not mistaken, four of us.
Yeah.
Yeah.
Probably.
I wouldn't say any red flags, but like what I mentioned earlier, if you go to a chiropractor, um, human and pets alike, and you notice that there is very little assessment, they come in, they just do the same thing over and over again, and then just crack left and right, up and down. Those are probably the thing that you want to avoid because think about it, right? When a bone misaligned, it usually misaligned. The bones is usually in a neutral position, and when a bone misaligned, it always go to the left or the right. And then obviously there's other types of direction and vector. So when a person cracks, say an animal or a human, left and right, up and down, you there's no reason for you to you're
When
not
it's back to the
correcting
original.
exactly.
Oh,
You're
okay,
not
yeah,
correcting
yeah.
anything because you crack the left and crack the right thing again.
Yeah.
You get what I mean?
Yes.
Yeah. So um, if you ask me, that's probably the red flag. Lah. When it comes to spine adjustment, it's very specific. Yeah, and it's not like what people are taking it very lightly because the spine houses the nervous system. It affects a lot of things. Yeah, it's not something that you want to take it lightly.
So it is, as pet parity, we should be really careful as well.
Yes.
Choosing, and like I think being a pet or animal chiropractor, you need to be licensed as well, right?
Yes, correct.
Yeah. Okay. So I know that I want to talk about your journey. I know you're very passionate about chiropractic and pets. We've definitely seen Tylo on your Instagram.
Yeah.
And I also I stalked you on Instagram a little bit. I saw that you unlocked your dream achievement.
Yeah.
Certified animal chiropractic. What was that journey like? And how does it feel like to specialize in both humans and pets?
Well, the reason why I took up that certification, it's all thanks to Tylo really. And my first pet, his name is Louis. He passed, but
Okay.
the first time when I started to work with animals, that time my mentor from Australia, he's a chiropractor in Australia, so he was with me in my house. So at that time, my first pet, Louis was suddenly limping and he had signs of pain, right, for weeks. And then we took him to vet, took an x-ray. Obviously at that time, I never thought that chiropractic can be applied to.
Of course.
Yeah, I never really looked into it. I don't know that there is this course available. So then
And that time you were already a human
Yes.
chiropractor. Okay.
I am, yeah, and my mentor was there. So happened we have the x-ray. Then we take a look at it, right? Then obviously we apply the theory that we have. And then we were like, okay, that lumbar doesn't look right. Should we do something about it? And then we did, right? So we just apply very gentle pressure, try to move the bone to the right position.
Right.
Fair enough, the next day, the limp just went away. He started walking normally.
Way.
Yeah. So that was the first time I
Discovered.
I discovered that, and I know that this is something that I want to look into. And then the next encounter was probably Tylo.
Yeah.
Tylo start walking, the same thing, limping again, and I look into it and I work on it. Then I was like, okay, and obviously his limp went away.
Yeah.
And from there on, I know this is something that I want to pursue.
Yes.
Obviously, I didn't want to do it without a license, and I want to know more. That's my character. I always wanted to know more. So I
Very curious.
yeah. And then I just took that, took the next step. Just went to Australia and have the certification done. And that's probably one of the biggest achievement, I think, because
That's amazing.
yeah. It's really nice because when you get to know them, you know so much you can help.
Yeah.
Yeah, because a lot of pet really have this kind of problem, and a lot of the time when they're in pain, they just can't communicate with you.
Exactly.
And the thought of it makes me feel very sad. Like many times the pet parents probably think that, oh yeah, my pet is frustrated or angry or the behavior changed, what's wrong, and then they start to blame, but not knowing that they actually have pain.
Yeah.
So simply put, for example, the other day, Tylo have a bit of skin reaction, irritation at the lips, right? So usually after he eat, we'll clean up, we'll wipe for him. So out of nowhere, he just suddenly becomes a little bit aggressive when I try to wipe him. It's because he's in pain. Yeah, so those are the things that I didn't know. My first reaction and instinct is that, why is he becoming like that?
Yeah.
Then I brought him to shower, and then the person mentioned, oh, he looks a bit like irritated down here. Then I only noticed that, oh yeah. So a lot of the times when they say pets' behavior is changing or they're not reacting the
Yeah.
right way they're supposed to, many times it's because we are not
paying attention.
Yeah,
and
they're not being detailed.
Yeah, I know people always say that it's never the pet's fault. It's
Correct.
always the pet parent
Exactly.
observing and paying attention to it.
Yeah.
Okay, so when it comes to treating animals, I feel like, to be honest, I feel pet care standards in Malaysia is still pretty low. It's developing, it's getting there. But I feel like there's a huge room to improve and to grow, right?
Yeah.
Right, interesting. So I know you've worked with many animals over the years, that you mentioned, like horses and then dogs and cats as well. Is there one case that has really stood out for you? What's something that is, can you share with us a case that's very close to your heart?
Close to my heart. I mean, I guess when it comes to the thing that is really memorable, I would say probably the first adjustment that I gave for Louis. And obviously the first adjustment I gave Tylo. I mean, because obviously they're in my own child, right?
Yeah.
That feeling is always gonna be the most special.
Yeah.
Yeah, seeing that I have the ability to help them.
That's amazing.
Yeah, that's definitely the reason that fuels me to be better, because I know in the future, whatever happened to them, I want to be the one that can actually help them.
Yeah.
But obviously, along the way, we have a lot of patient that comes in, especially the elderly patient, where they're like, the oldest patient I have is 19 years old.
What?
Yeah, 19 years old. Her name is Misty, and that's the video I sent you. Was it the one? Another one. Sorry.
Okay, but
Yeah.
send me the video and we definitely like link it up.
Yes,
So,
yes.
yeah.
So at one point, she can't really walk very well because of her age. She have a lot of arthritis is going on. Obviously, the alignment is not in a good shape. Her spine is not in a good alignment for a long period of time, and one
Spine
thing
is
leads to yeah.
Right. Okay.
So the thing about chiropractic, right, is that when your bone is not in a good position, and if you leave it for a long period of time, things is only gonna worsen. It's almost like a cascade, right? It's like you have a decayed teeth and you didn't work on it.
Yeah.
Over time, it's gonna spread.
Yeah.
And it's gonna make things worse.
Makes
Same goes to the spine. That's why a lot of elderly patient takes a lot more work for them to be better. So this patient initially she can't really walk and she have weakness because her nerve is being damaged and compressed. So she always have that gait where her hand just like go flat out and open and fall. She can't stand when she poop and pee. You obviously everything would get on her body. So then after a few adjustment, she actually improved quite a lot. So that is one of the case that was memorable. I can probably share it with you.
I think you mentioned that, like, for senior pets, right? Is it better when pets are being sent in to you like as early as they can, so that we address the issues earlier,
of course.
rather than like waiting, right?
Of course.
Okay.
Not just senior pets, even for like young pets, right? Same goes to human. The thing about chiropractic is that we don't always ask them to come in only when they have pain. Prevention is the key.
Right.
Yeah, just like if you want to have like a healthy teeth, you're always preventing it, right?
True.
So that's why we always get to prevent it. There is three things, right? Obviously, we get them to come in and we'll check the spine from time to time. That is always very important.
Right.
And the good time would be 3 months or even half a year
Okay.
minimum. The way we carry the dogs and all that, that's a good way to prevent it, because if you know how to handle your dog, injury will be much less.
Yes.
And then obviously the last one is inactivity. So if they are not active and they're moving very little, they don't develop muscle, the problem is going to come. So we always recommend dogs to be active.
Wow, very important perspective, like the three things to watch out for. And I like that you mentioned 3 to 6 months is kind of like the maintenance time when they need to come in and
Correct. Sometimes even if the spine is good and there is no adjustment needed, I wouldn't charge my patient. I just ask them to come in and at least get it checked, right?
Wow.
At least you know it's okay.
Yeah, interesting. Okay, so thank you for sharing all of these new perspectives for us pet parents. Last question that we always ask all our guests before we end the session is, can you then share with us one perspective that has changed your life as Dr. Daniel?
I guess these days when I look at a human being or dogs, I'll pay a lot more attention to handling them, interacting with them, or just when they walk, when they sit and all that. I just make sure that everything has to be in the right way so that it doesn't injure them. Yeah, so for example, sometimes when my wife is sitting, I would just make sure that I try to make sure that she have a good chair, she have a good support.
Yeah.
And when my dog is sitting and is not in a good position, I'll then subtly try to correct the position and all that. Make sure I
So
put the
even
pillow
at
under
home, you're like trying to like do this.
in a subtle way, okay? Yeah.
Okay, very interesting. So, okay, So that brings us to the end of today's episode. Thank you so much for sharing so many valuable insights into the world of pet chiropractic. Whether you as a pet parent, you're new to the idea, or you've been curious to pet chiropractic for a while, we hope this conversation gave you a clearer picture of how chiropractic care can support your pet's health and well-being. I think this conversation reminded me why I'm such a big advocate for integrated care. It's not about replacing your vet. We're not advocating for that. I think it's about looking at new ways or exploring new perspective to improve our pets' well-being. So if you love today's episode, share it with a fellow pet parent, leave a review, and let us know, would you try chiropractic for your pets? As always, please do your own research because no one knows your pet better than you do. Signing off and see you in the next episode. Thank you so much.
No problem. Thanks for having me.
Yeah.